Hello, myself Dr. Soumya Basanth, working as a cornea consultant in Zamindar's Microsurgical Eye Centers for the past 1.5 years. Do you have any of the following symptoms? Dryness, irritation, grittiness, redness very often, defective vision? Probably you're dealing with dry eyes. Probably if you have all these above said symptoms, you might seek a medical attention. You might come to an ophthalmologist. Immediately, when you report to us, what we do is we check your vision. If there's any refractive error, we go about correcting the refractive error first, and then the optometrist or the optician gives you a form to fill up. It's a brochure. It's called an OSDI form. OSDI stands for Occulosurface Disease Index. This is a small format, a brochure which is given for all these dry eye. They have a set of patients which they choose to give these brochures to. Every patient who walks into the OPD is not given this brochure. There are few classifications or categories of patients which our optometrists are trained to give these brochures to. Who frequently are given these forms? Usually computer users for more than 8 to 10 hours. I think we find in a lot of professions people use computers for more than 8 hours per day, and all menopausal women, any women above 40 to 45 years of age who have reached the age of menopause, they are given this. Diabetics commonly who we give these forms to. Then the other categories of patients, immunological based diseases like rheumatoid arthritis, these patients are also given these forms to fill up, and based on this the optometrist is trained to score the formats. These OSDI forms are filled. Okay, then there is a classification in the OSDI forms. Anywhere between 0 to 12 there is a marking. They are termed as normal. About 12 to 22 are categorized as moderate, and above 32 is categorized as severe dry eyes. And this the optometrist reports it to the doctor. When the doctor sees probably and then goes and rechecks the history and the OSDI forms, certain other tests are performed to categorize these patients as dry eye, and dry eye is further subclassified as mild, moderate and severe. We do various other tests inside my office, the doctor's office. Basically we do Schimmers. There are a lot of tests. Okay, conjunctival staining. We take into account all these tests, the results of all these tests, finally categorize, and all my treatment is basically based on the type of dry eyes the patient has, either moderate, mild or severe. My whole treatment is basically we categorize them, and then only my treatment starts. Because mild patients, the patients who come under mild category are treated differently. Moderate, the patients who fall in the category of moderate are treated differently, and the patients who fall under severe category are treated very differently. Please do not neglect any symptoms of dryness, grittiness, sand or gravel feeling in the eye, frequent redness or frequent blinking or any refractive errors. Please consult your ophthalmologist for the treatment.